Well, the province unveiled its budget yesterday, and it has more spending than ever before. Ontario will spend $204 billion this year. That is $21 billion more than the budget in the middle of the COVID-19 pandemic. The amount being brought in from personal income tax is up by about $53 billion, a 31% jump from a couple of years ago. So what does this all mean here? We've invited Andrew Dowie to our studio to talk about that. He's the Conservative MPP for Windsor-Tecumseh and the Parliamentary Assistant to the Economic Development Minister. Welcome.
Delighted to be here, Peter. Thank you for having me.
So what is in this budget for the people of Windsor-Essex and surrounding areas?
You know what? I'm just so delighted to see everything that's in here for our region. Particularly, you may recall the Stellantis EV, the Nexstar EV battery plant. Really, that's the culmination of multiple industrial policy changes over the years. So $16 billion has been invested in Ontario by global automakers and suppliers of EV batteries. So the Volkswagen announcement just came out. The details are yet to come, but obviously the provincial support for that is going to be part of this budget. Hospital infrastructure, the Regional Acute Care Hospital. Let there be no doubt, this hospital is being built by this government. That it is not going to be an omission as we'd seen in the past. It had yet another mention in this budget. The funding is there when it is needed for us to proceed. Highway 3 continues to be funded under in this budget between Essex and Leamington. The renewal of schools. Actually, this morning I'm going to one of them, the former DM Eagle, the new North Shore French Immersion School. That's funded through this budget, as had been the Catholic Central, which had been announced for the opening a couple weeks ago. Obviously, childcare spaces as well as part of the different school improvements. The Learn and Stay grant for those who work in medical fields, but particularly nursing, medical laboratory technologists and technicians, to work in underserviced communities. Obviously, we've had this struggle for a long, long time. So Learn and Stay grant is one that we will benefit from tremendously. If you decide to practice here, you will have incentives to stay here for a number of years. High-speed internet is something that we have needed in Essex County for a long, long time. Particularly in my area, Oldcastle, a lot of the plants are world-class, high-tech, but they don't have the proper internet yet. So $4 billion is part of this budget to ensure connectivity. And finally, two other items I wanted to note. One is for rural Ontario, which is often forgotten, new veterinary medicine program at the University of Guelph and Lakehead, because we don't have enough agricultural veterinarians, and so it's holding back some of our local farms and their ability to provide food for Ontarians. And I wanted to mention the $224 million for training centers, including union trading halls. We do a great job here in Windsor. Many of the different unions do their own training on site at their halls with an exceptional pass rate. In the 90%, I think it's 98 for some of them. And so we want to support success in those sectors to get people the jobs that they want to have, that fulfilling careers, and that they can provide well for their families.
Now, that last item you mentioned, I'm assuming that is aimed at addressing the shortage in skilled labor that we have in Ontario?
100%. Our employers need workers and our unions need members. But beyond that, Ontario needs those skills because we are competitive thanks to the government's policies and attracting the investment, but now we're running into the workforce shortage. So we want to give every opportunity for those who have an interest in these kinds of positions to have a great paycheck at the end of the day, to get trained and upskilled as quickly as possible so you can get into those sectors and start providing great things for the people of Ontario.
You mentioned that there continues to be a plan to build the new hospital on the edge of Windsor, but Mr. Dowie, we are seeing right now long waits at hospital emergency rooms, long waits for surgeries, long waiting lists for family doctors. What is in the budget that will address those kind of challenges right now in our community?
Well, the aforementioned Learn and Stay grant. I mean, really, we need to rebuild our workforce, and this government has invested countless times to expand the workforce. We have seen a record number of licenses for nursing in 2022. So the plan is working. We're getting more and more people going into the sector to work, but that is really the limiting factor. I would also note the programs like this Windsor Surgical Centre that's off in Forest Glade East Riverside, that has opened up new operating room space. So we have more capacity to do outpatient surgeries. We don't need to funnel everything into Windsor Regional and add to those wait times for some of those outpatient surgeries. Rather, they can be done offsite in community clinics that are run through a number of different models. So offering more capacity, offering more opportunities for employment, and also the 13 ailments that pharmacists can now prescribe drugs for without a medical visit. Otherwise, that's going to take some load off of the work that our physicians need to do. They're being run ragged, not just the physicians, the nurses, and everyone involved in the system. They've got so much work on their plate, and we need to take some of it away and spread it to new directions.
The thing on the front of many people's minds is the cost of living, and just every time you go to the store to get a pound of butter or a package of pasta or something, you notice how much everything is costing these days. What does the budget do to help regular people with their cost of living?
Well, in the election, and actually before the election, it was announced the gas tax and fuel tax rates would be cut until basically until the end of the year, and now we're doing that. We're continuing till December 31st of this year as part of this budget. So that's a 9 cents off per liter. And that is something that does affect the cost of transportation of goods. So when the store buys products or the restaurant buys its supplies, it's paying for the cost of delivery. So we're bringing the cost of delivery down, but also your cost to get to and from work by not charging as much on gas and let it, government being part of the solution for high prices at the moment. Something new under this budget is the Guaranteed Annual Income System program, the GAINS program. This is aimed towards seniors. This is a top-up for the OAS. And so starting in July 2024, over 100,000 additional seniors will be eligible for the program, and the benefits won't be capped. They're going to be adjusted annually to inflation. So that is something that's new, and it's going to help 100,000 new seniors. Right now, there's about 200,000 in the system who are getting it. So this is another 100,000. So this is tremendous news. And finally, I'd point to the $202 million each year in the homelessness prevention program and Indigenous supportive housing program. So those that are at risk of homelessness or experiencing homelessness, and those escaping intimate partner violence, they need help. They don't have the resources, and now we certainly want to be there to support them and support the community organizations delivering supportive housing. So taking that burden or lessening that burden is key for our government.
All right. Thank you for coming in this morning, Mr. Dowie.
Oh, thank you, Peter. I appreciate being here.
Andrew Dowie is the Conservative MPP for Windsor-Tecumseh.